So, doctors and nurses. One of the biggest struggles for doctors and nurses was that they didn't know what the flu was or how to treat it at first. And so they started recommending things like eating cinnamon, drinking wine, and drinking beef broth, all just in an attempt to see what would help because they just didn't know enough about it to know what would help. And they also prescribed aspirin to alleviate symptoms, but because of a lack of knowledge at the time, they prescribed a dose that was way too high, and it actually ended up being toxic and killing a lot of people. So that added to the death toll. And there were no vaccines and antivirals for doctors to give people at first, so that also made it a lot harder for doctors. And then doctors and nurses had to work under very difficult conditions during this time. Because a lot of healthcare workers had been called to World War I, there was already a shortage of doctors and nurses, and then wounded soldiers coming back from World War I added to the number of patients doctors and nurses had and stretched resources even more. So we have a quote about visiting nurses who went to patients' houses to take care of them, and it says, visiting nurses would see on average 20 to 30 cases in a day, with the highest at 40 cases in a single day, and each case might be more than one patient. Nurses often cared for most of one family in a single call. Some arrived too late to provide care and instead found bodies and orphans. So that shows how understaffed hospitals were, that nurses had to care for so many people in a single day. And then working environment. Because because hospitals were so understaffed, there was always the threat of getting sick. Doctors and nurses were under constant stress, and that was made worse by the lack of resources. Some doctors actually had to wear homemade masks that they made out of gauze and wire frame because they were running out of materials. And these healthcare workers were constantly exposed to the virus, which resulted in a lot of them getting sick, and that left hospitals even more understaffed. Although a relatively small number of doctors and nurses actually died from this flu, but even so, these deaths had a great impact on the remaining workers. Basil Hood, who was a medical superintendent at an infirmary, gave a quote on nurses becoming sick during the Spanish flu pandemic. He said, "Each day the difficulties became more pronounced as the patients increased and the nurses decreased, going down like nine pins themselves. Sad to relate, some of these gallant girls lost their lives in this never-to-be-forgotten scourge, and as I write, I can see some of them now literally fighting to save their friends, then going down and dying themselves," which just shows a bit of what it was like to work in a hospital during this time and the great stress that these doctors and nurses were under. And doctors and nurses also had to help to develop containment strategies, which added more stress to what they had to do. And in general, the two strategies were isolation of the sick and then the temporary closure of public places.
Yeah, so with regards to like clinics and hospitals, the American Red Cross, because of World War One, was actually like a really big organization. They had like 14 regional divisions and over 12,000 staff, and so they were actually a really big help in like the early parts of this pandemic. They were able to like work with like the local government to distribute like medical equipment, drugs, medicines, and even nurses. And so they were able to help fill in like all like the hospitals that were understaffed, although it wasn't enough, but it was something that helped. Um, because there were so many patients, they had to set up lots of temporary hospitals. So those were set up in like schools, like auditoriums, and like dance halls, like even private homes if they were big enough. And there was also like an open air treatment, so they would set up like many outdoor hospitals outside because, like Ahana had said, um, they found that like the open air was better at treating the virus. So being outside actually kind of helped. And nurses had to like, they were in short supply, so nurses had to wear masks and to protect themselves in these hospitals. And they also boiled like anything that the patients had used, like plates and utensils, to kind of get rid of the virus so they could reuse them. And hospitals were often overfilled and understaffed. Some worked at like 10 times the capacity they were supposed to, and many people were turned away if they had mild symptoms. And again, that's because of World War One. All these nurses and doctors were going off to Europe to treat all the soldiers. And so to kind of, again, like the Red Cross helped somewhat, but also many medical students were brought up early to fill in these empty spots. So some people who are just, getting like their like just getting out of school or had to like come up and start helping out in the pandemic with like little experience. And again, they were short on supplies, so they had to reuse masks, and they often lacked like basic medicine. Um, and because there were so many people that were dying, hospitals often had to just stack the bodies in the caskets wherever there was space, even if that was out like on a street. Um, and so